The goal of a Silver Lining Foundation is to make sure that uninsured, underinsured, and undocumented women and men have access to breast health testing. Dr. Sandy Goldberg created the foundation after her own personal experience with breast cancer. Tell us how your journey helped you found in 2002 your organization.
When I was diagnosed with breast cancer, I was fortunate that I had everything I needed: support, love of family and friends and coworkers, but most importantly, great insurance. And that, Suzanne, is when I discovered that I was one of the lucky ones. And most people out there, even in 2020, when I was diagnosed, had nothing. They had no access, and worst of all, they felt they weren't worthy because they had no money and they had no insurance. My husband and I sat down at the kitchen table and decided we must do something about it. And that's when we founded a Silver Lining Foundation.
And that foundation has 5 core programs that help. Tell us about that.
Our programs range from outreach and resource information to acquainting women about breast cancer and what it does mean. But the core of what we do is we fund cost-free breast health testing, literally soup to nuts, from screening mammograms through biopsies for those, as you said, that are uninsured, underinsured, and undocumented at now 17 partner hospitals. And that's really the best.
How can someone find out about the locations of those hospitals and how they can help your effort?
Go on our website, asilverliningfoundation.org. Don't forget the A. You'll see a tab, I want to help or I need help. All you need to do is click on that.
You know what, tell me this, how do you go about the outreach? And also, one thing that you've shared with me in the past is people shouldn't be thinking of pink, as you're wearing, in the month of October for breast cancer awareness, but think about it more so year-round, right, when it comes to outreach and just awareness.
Outreach, we've discovered, comes from any number of resources, from clinics, hospitals, a lot of word of mouth. And the important thing, as we talk about pink, is the focus seems to be, there's the color of the month, there's the disease of the month. When you talk about access to breast health testing, from one year to the next, it can mean the difference between a clear mammogram and a diagnosis of breast cancer. That is why think pink 12 months a year.
And again, one of the events that we just looked at there was one of your fashion shows that you have each year to benefit this incredible cause. Thank you so much for joining us and sharing your journey and how you've been a blessing to others and helping them through their own diagnosis.
And thank you for your support, Suzanne.
Thank you, Dr. Goldberg.